For my service learning project, I have chose to volunteer at the Ronald McDonald House in Hershey. Let's begin with a brief introduction to the Ronald McDonald House. The first Ronald McDonald House opened on October 15, 1974 in Philadelphia, Pennsylvania, through an unlikely partnership. A player from the Philadelphia Eagles, Fred Hill, had a daughter who was suffering from leukemia. The team supported Fred and his family and raised $100,000 for Dr. Audrey Evans, an oncologist, and her colleagues at the Children's Hospital of Pennsylvania. While the $100,000 would go a long way, Dr. Evans requested that the team raise $32,000 more to fund a house for families of children who were in the hospital. This request was met by Ed Rensi, an area manager for McDonald's. McDonald's donated their proceeds from the Shamrock Shake to the cause, and thus the Ronald McDonald House was created. Today, there are over 365 Ronald McDonald Houses in over 64 countries and regions all across the world. The Ronald McDonald House in Hershey, which is where I completed my service learning project, opened on November 19, 1984, and serves the families of children who are patients at Penn State Hershey Children's Hospital. The mission of the Ronald McDonald House is to serve children and their families by providing compassionate and accessible support through programs and healthcare partnerships. Many families who have an ill child must travel away from their homes to get the healthcare they need for their child. When this situation arises, families must determine where they are going to stay during their child's hospital stay, where they will eat, and they must worry about the income to be able to do all of this. In terms of the Ronald McDonald House, families do not have to worry about anything other than their child's health needs. The Ronald McDonald House in Hershey allows any families with children hospitalized to stay for free. Meals are provided by volunteers who come and cook for the house guests, and a shuttle service is offered to and from Hershey Medical Center to the house. By volunteering at the Ronald McDonald House, I was able to learn that many families who stay at the house have a child who requires treatment for cancer, chemotherapy, radiation, surgery, doctor's appointments, etc. Hershey Medical Center has one of the best children's hospitals in the state, and due to its convenient location in central Pennsylvania, many come to get the best care possible for their child. The following two slides will discuss how the healthcare professional plays a role in the social, cultural, economic, and political issues that children with cancer face. When a child is diagnosed with cancer, their entire life may change. School may be disrupted due to the course of treatment required and the side effects that may occur, such as nausea and exhaustion. Some children may even have to be homeschooled due to their immune systems being compromised. This may lead to isolation that results in the loss of friends. Parents are encouraged by healthcare professionals to let their children go to school as much as possible. This will allow them to keep a normal routine and offer a means of support as their friends and teachers will be informed on their progress. If their child is taken out of class due to their weakening immune system, a school nurse could educate their classmates on their condition as to why they are not in school. The cultural issues that may arise include language barriers, lack of trust between patient and the family, or patient, family, and the healthcare provider, the use of complementary and alternative medicine, and coping end-of-life issues. Some patients may travel from another country to receive the best oncological care in the world for their child. Due to them being from another country where English is not their primary language, this may result in a language barrier that could also lead to mistrust between the family and the healthcare provider. The family may feel as though they are not being told everything they need to know about their child's condition due to the language barrier. This may lead to them not trusting the oncologist who is treating their child and may ultimately affect the care their child receives. Another cultural issue is the increased use of complementary and alternative medicines. Not only should healthcare providers be educated on what the best treatment option is for the pediatric patient, but they should also be familiar with alternative methods. For example, in children with pediatric cancer, healthcare professionals should familiarize themselves with the use of medical marijuana to treat side effects of chemotherapy, since it has become more widespread due to its legalization in the state. Healthcare professionals should also be aware of how different cultures may cope with their child's diagnosis of cancer and any end-of-life issues that may arise. Next, we'll discuss the political and economical issues. One political issue faced by this population is the amount of funding that is allotted to the National Cancer Institute each year to conduct research for pediatric cancer. Since so many children are diagnosed each year with cancer and there's currently no cure, funding needs to be a priority so that the National Cancer Institute can continue to perform research studies. By continuously funding the Cancer Institute, we can come closer to finding a cure for this awful disease. The economic challenges are the ones that can be seen in those families that stay at the Ronald McDonald House. Due to the increased healthcare needs of their child with cancer, work disruptions can occur for parents. This results in a loss of income and possibly even the loss of health insurance. Parents may also have to pay out-of-pocket expenses for their child's healthcare, which includes any travel expenses. All of these are financial hardships that families may encounter. Healthcare providers should be aware of the different resources that they may offer these families in their financial time of need. When deciding on an organization to volunteer with, I wanted to do something that I could relate to my nursing career. I emailed a handful of organizations that dealt with either mothers and newborns or pediatrics, since I currently work as a maternal newborn nurse, and in the future, my ultimate goal is to become a pediatric nurse practitioner. After contacting these organizations, I decided that the Ronald McDonald House in Hershey would be the best fit, and that the time I spent there would be the most beneficial for myself professionally. By selecting the Ronald McDonald House, I was able to integrate my knowledge to address the needs of families who have a child with cancer. By volunteering with this organization and specific population, I gained insight for my future career in nursing as a hopeful pediatric nurse practitioner. I started my service in November of 2017 and volunteered at least twice a month for 4 hours. A journal was kept of entries from each time that I had volunteered. By the end of my service learning project in February of 2018, I had accumulated the 30 hours required for the project. As far as recommendations for the future, I would increase the number of hours needed. Since there are always new families checking into the Ronald McDonald House, there are so many stories to be heard. By increasing the number of hours, students will be able to meet more families and hear their stories. Another recommendation would be for the student to rotate shifts at the Ronald McDonald House. The shifts are as follows: 9 a.m. to 1 p.m., 1 p.m. to 5 p.m., and 5 p.m. to 9 p.m. I usually worked the 1 p.m. to 5 p.m. shift, as this was the time that worked best for me, but I did work the 5 p.m. to 9 p.m. shift once. During the 1 p.m. to 5 p.m. shift, most families are relaxing as they spent their morning at the hospital, or they are over at the hospital during this time, spending time with their child. Either way, the house was very quiet during this time. During the 5 p.m. to 9 p.m. shift that I had spent at the house, most of the families were back at the house congregating and eating dinner in the kitchen. This would have been a great opportunity to spend with the families and listen to their stories. A third recommendation for this project would be for the student to meet with their designated advisor in IPC 302. By meeting with their advisor this early, the student and advisor can agree on an organization, and the agreement could be signed. I would make the agreement part of the requirement for IPC 302 so that it's done way ahead of time and the student is prepared to begin their service learning hours. following 3 slides will point out the students' 3 objectives and how those objectives were met. The first objective was, during my service learning project, I will set up a minimum of 5 rooms for guests prior to their stay at the Ronald McDonald House. Since there was always a high turnover of families who stay at the house, this objective was easily met with ease. There were some days that Debbie, the lead housekeeper, and myself would put together 5 rooms. During my service learning project, I prepared a total of 17 rooms for incoming families. The second objective was at the end of the service learning, the student will be able to identify 3 socio-economical issues that families who stay at the Ronald McDonald House encounter in the healthcare system. When a child is hospitalized away from home, there are many considerations that a family must take into account. 3 socio-economic issues that this population encounters in the healthcare system are income, the environment, and education. All of these socio-economical issues were encountered in one way or another by the families who stayed at the Ronald McDonald House. The third and final objective was, during my service learning project, I will give 2 families house tours at the start of their stay at the Ronald McDonald House. This objective was also met with ease, in part due to the high turnover rate. During my hours spent volunteering at the house, I was able to give 3 families house tours. I showed them all the common areas, explained to them the rules of the house, and for the finale took them to their room. One thing I had noticed during my time spent at the Ronald McDonald House was that many families return to stay there when their child is rehospitalized. Hopefully the 3 families that I had given tours to will follow suit. The next 3 slides will discuss the impact that this service learning project had on the population and the student personally and professionally. The biggest impact that the service learning project had on the population is being a source of support. Part of my service learning was being able to sit with these family members and listen to their experiences regarding their child's health care. By being able to sit and have this conversation, I was a source of emotional support for these individuals when they had no other means of support due to being away from home. Another impact was the decrease in the amount of stress that these families had to worry about by being away from home when their child was hospitalized. If there were no Ronald McDonald House in the area, these families would have to worry about which hotel they would stay at, what will they eat during their time in Hershey, and how will they be able to afford these costs since they are not working during this difficult time. At the Ronald McDonald House, families do not need to worry about a thing. All the basic necessities are provided to them free of charge. Meals are provided by volunteers. The pantries are always stocked with snacks, and the guest rooms have linens and bathroom essentials stocked at all times. Regarding the personal impact, there are several areas to take note of. The first is individual growth. I'm grateful that I was able to volunteer along the pediatric population and serve in my local community. By choosing this population, I was able to see firsthand the struggles that they face, which were introduced to me through academia. By seeing the successfulness of this organization with this specific population, I can relate them to another possible solution for another population. For example, the Ronald McDonald House is available only to families who have pediatric patients hospitalized. But what if an organization was able to introduce the same basic principles of the Ronald McDonald House, but geared towards adult patients who have to travel for chemotherapy? Finally, the service learning project also had an impact on me professionally. In the future, I would like to return to school to get my master's in nursing so that I can practice as a pediatric nurse practitioner. By being aware of the healthcare issues that pediatric patients face when diagnosed with cancer, I know how to approach the families of these children as a nurse practitioner and educate them on what to expect should they have to face the same challenges that these families at the Ronald McDonald House did. I would also be able to refer these families to the Ronald McDonald House as a resource should they have to travel for their child's healthcare needs. This concludes my presentation. Thanks for watching and listening.